So just to kind of go over, other than hormonal changes, what else can cause hair loss? You know, just to kind of keep it broad here for people just thinking of general kind of categories.
Yeah. So there are many things that I won't go through all of them,
Yeah.
but just to suffice it to say that there are many, and it's not uncommon for people to be misdiagnosed.
Mm.
So I'd really just want to emphasize that it's good to make sure you see a hair specialist, if not myself, a board certified dermatologist who's trained in recognizing different hair conditions and can start treatments early. So make sure you get a good diagnosis. Don't wait, to the people who are watching, don't wait so you can start early and you can have much more of an impact if you catch it early. In general, I like to break it up into three different categories. There's what's referred to as non-scarring hair loss, which is hair loss that is sort of reversible, and that includes most commonly male and female pattern hair loss, but also things like alopecia areata, or alopecia areata is the autoimmune hair loss, and then trichotillomania, or someone like pulling out hair. Those are things you might see in the non-scarring hair loss.
Mhm.
The second category is scarring hair loss, which a lot of people aren't as familiar with, but we're seeing a lot of cases about this, especially, for instance, in the African American community. There's something called CCCA, where it looks like male pattern hair loss. They get thinning on the top, but those hair follicles are actually being lost through a scarring process. And then there are other things like frontal fibrosing alopecia, where you're getting scarring, hair loss along the front, or like in plantar pilaris, other conditions that you can get, which are scarring. And then the third category is kind of like other category, things like genetic disorders, metabolic conditions like deficiencies in zinc or iron can cause hair loss as well. So those are the three broad categories you can think of.
Right. And then would you say also like certain medications, like or like chemotherapy or something like that as well?
Exactly. So yeah, you can have medications cause a hair loss in the growth phase, or even afterwards in the non-growth phase or the falling out phase. So either anagen effluvium, we might call it, effluvium referring to like the shedding, or a telogen effluvium more commonly. You might see it after like a stressful event, like a surgery,
Right.
or for instance, after a pregnancy. It's not uncommon. A couple months after that health event, then people might shed their hair.
And I had that Bell's palsy episode and severe shedding starting kind of on the tail end of that. So perhaps that was a trigger on top of sort of the underlying stuff. But, I agree. And then, also I just wanted to point out iatrogenic causes of hair loss, since I do surgery, not just on the scalp, but also, something like a facelift can, easily cause the temporal tuft to disappear because of, what the doctor did. So whether it's, something that can be avoided or sometimes cannot, there's a cancer that's removed, but, I guess it's, maybe it was an obvious one, but just something to point out that, sometimes it's something I cause, when
Yeah.
doing surgery.